again before, and look at that. There's the after.
Look at
Wow.
that.
Woo!
Well,
The cream or the Philly cream cheese on top.
I guess we're having brunch in Chalampago this morning.
The plate sold me. I love that plate.
Yep. That's like United Nations. Chinese plate, Mexican Chamorro fusion breakfast burrito.
Thank you, Bev Test J Solid.
And Philadelphia.
Yeah. Breakfast burritos, everybody send us your pictures and we'll put them up.
Right
you
on.
guys are making us hungry.
I'm going to make mine this weekend.
Okay.
Okay, guys?
I was hoping maybe this week, which would be Friday, which would be tomorrow.
Yeah, okay. 8:50, Lillian Posadas, hospital administrator, joining us now in the KUAM News Zoom room. Hope we didn't make you too malago with our breakfast burritos, Lillian.
It's okay. I'm busy doing other stuff, but that sounds good.
It does.
Not
right?
good for the heart.
That's not that bad. That's why you eat it in the morning nice so you burn it off in the day.
Okay, good idea. All righty. Good
All
morning.
right. Good morning.
Good morning.
Thanks for joining us, Lillian. I guess we'll just first start as we had seen there was a little bump in the number of, first the number of, and it's interesting that we get like 4 or 5 positives. We're like, oh, it's a bump, right? But there was also a slight increase in hospitalizations, COVID-19 hospitalizations at GMH. So let's just start there. What's the situation with COVID-19 at the hospital?
Sure. A couple of days ago, it went up to 4. We are back down to 2. And so, we're hoping and praying that we continue to stay in this low trend. And so, and the good news again is that the individuals who come into the hospital are not at the level of being critically ill, so they don't need to be in the ICU level of care. So it's a good sign.
Have any of those patients who were hospitalized, had they received the vaccine at all?
No, they didn't. They weren't vaccinated when they came into the hospital.
Did they get vaccinated on their way out?
They will be. They will be vaccinated before discharge. That's been the protocol and the practice that upon discharge we offer the vaccination to the patients.
Do they take it, or just some of them decline?
For the most part, those accept it and they take it. We've vaccinated a little over 100 as of last week. I haven't gotten the latest count this week, but as of last week, there was like about 107 individuals who, upon discharge, received the vaccination.
Which vaccines are you guys administering?
We were offering the J&J one-shot vaccination, and so now there is a pause on that one. So we'll most likely switch over to either the Moderna or the Pfizer.
How many outgoing patients did you vaccinate with the Johnson & Johnson vaccine?
About 107.
Okay, also all of them. I got it.
Mm-hmm. Yeah, that's what we were offering, is the one shot for the discharge patients. So we're going to switch over now to Moderna or Pfizer.
And then, so they're going to get the one shot on the way out, and then they get the second at maybe one of the clinics or something, or the Vax pod?
The first shot, right. They will have to be followed up for the second shot. Yes, correct.
Moderna or Pfizer?
Whatever is, again, depending on our allotment from public health, depending on what we have.
Has anyone that got the Johnson & Johnson come back to the hospital?
We haven't seen that. Yeah, we haven't gotten any of that report that they have come back with some adverse effects or, issues with it.
Okay. Well, let's talk about the new hospital. I know when we last spoke, it was kind of brief because of our time constraints. So the task force meeting was postponed. Did you guys ever meet since then?
Yes, we did.
Okay.
We met Tuesday. The task force met Tuesday, and it was facilitated by YITA, because they've been in communication and meeting with the performance-based contractor, which is the Matrix Consultants. They are the ones who are, granted by the Office of Economic Adjustments to handle the grants that come out of that are approved by OEA. They're the recognized consultants by OEA. And so Gita has been meeting with the consultant group Matrix, and the meeting that we had on Tuesday was basically to then have a briefing and update on the various site locations that they've been assessing and looking over. And so that was presented to the task force.
Is there still 3 sites, or is there more than 3?
There were more than 3 sites that the team, Mel's team with Matrix, there were more than 3 sites that they presented, that they updated us.
Okay. Can we get
There were several sites.
Okay. Can we get a breakdown of those sites?
Sure. I mean, again, I don't have a copy. Let me see if I have it with me, a copy of the PowerPoint presentation. But the first that I remember is Atacao. That was about 102 acres. Then there's the Andy South, and I believe the South Finnegan, which we have talked about. Let me see if I can pull up the PowerPoint from Gita.
I know in
I
the
remember. Go ahead.
in the Ancestral Lands Commission oversight, they were mentioning Nimitz Golf Course area.
The old Nimitz Golf Course, correct.
Okay.
Correct. And then this Oka Point here at the cliff line where the old hospital used to be, where the Chamorro Land Trust has oversight over. So that one I think has, gosh, I'm trying to remember whether it was 30 some acres or I think it was 35 acres was what I recall. Maybe I may not be all that correct in terms of the acreage, but what I remember was either 35 or 60 some acres for that Oka Point. So
Do you have
and per land, go ahead.
Go ahead.
Per land management, Joe Borham, factoring, because it's not just going to be the hospital, it's a campus that will have public health, behavioral health, and Guam Memorial Hospital, or a government hospital. And so all those 3 major facilities in one location, plus factoring in the need for parking space. Joe Borja was estimating that we need over 100 acres for the campus to then make sure we have those 3 major facilities and parking,
So
and possibly having some clinics, medical offices for the doctors.
So then that would kind of rule out Oka Point if there's only 35 acres there, right?
Right.
What about
Right.
Eagles Field? Is that still on the table?
And are you concerned at all about some of these issues of original landowners that have been brought up recently?
That was not discussed at the meeting Tuesday, but Senator Teresa Falahi was present. She was part of she's part of the task force, and so I don't remember the issue with regards to original landowners and
Well, because it's excess federal lands being returned to the government of Guam, and I think that they're supposed to offer it to the original landowners.
Again, it wasn't discussed at that meeting in the task force, but I know that the speaker had a hearing last week.
Yeah.
I didn't get to see what transpired, and I don't have any update on that one.
Any other property? This is pretty much it. All right.
Gosh, it was quite a bit. It was quite a list, and so like I said,
see.
I did not I'm trying to pull up the PowerPoint presentation from Gita and trying to find it at the same time speaking with you, and so I'm not very good at doing 2 different.
That's okay. Maybe later we can get the list.
But do you have a preference, Lillian, as just like a hospital administrator? Which of these properties do you think is the most favorable, based on proximity to other hospitals and just, generally
land you
speaking?
need, yeah.
The land you need.
Well, and as I mentioned before, again, I'm advocating for the whole island of Guam, particularly for the people of the South. And so the central location is where I would, is my desire, my preference. And so, it may not be the Eagles field, but it is central. But there is another one that they were mentioning that at least is closer towards, for the people of the South. The South Finnegajan is along the same route where GRMC, and again, it's very up north. And so, while it has a lot of acreage, my preference is, again, central Guam. And so, again, it's for the whole island of Guam, not just for, particular group of individuals. It's for the whole island that it will be beneficial for.
Do you then recall off the top of your head then any other central land or properties that you're looking at other than the one that you provided earlier?
Atacao, and I've yet to make my own, site, I guess, assessment there where it's at, but it's Atacao. Andy South was mentioned. I'm trying to remember
That's
where
central?
else.
That's central. I know you said the Nimitz Golf Course is the one you confirmed. Eagles Field, Oka Point.
Nimitz Golf Course, yeah.
Nimitz what? I'm sorry?
We're still getting more information on it, on the various sides.
Okay.
But I think of the 10, I believe, we narrowed it down to either 3 or 4.
What are the 3 or 4?
The Atacao, Andy South, Eagles Field, and I can't remember what the 4th one is. I think it was 3 or 4. So again, let me go back to the PowerPoint presentation. I can find that.
And these are the 3 to 4 that you kind of the task force said, okay, these are the ones we're gonna.
Oh yeah, and the 4th one I think was the Oka Point. A couple of the members of the task force were still advocating for the old Oka Point.
Right.
Mm-hmm.
But do you know offhand who's on the task force?
It's a long list. The Gita team, that's Mel Mendiola, Joanne Camacho, Diego Mendiola, Tina Garcia. We've got from the office liaison, that's with the military, Vera Tapasnia, Guam, Dagura, Mr. Ray Tapasnia, and Mr. Sunny Perez. We've got some people in the private sector, Ruth Gurusamy from HSP, and we have Dr. Margaret Hattori, University of Guam School of Nursing, Mr. George Bamba, the senators, Speaker Teresa Chalahi was on the task force on the last meeting, Senator Sabina Perez, Senator Tello Tidegree and Senator Chris Duenas were in the first meeting on the 24th of March, but I don't recall them attending this Tuesday's meeting. We've got, we invited Mr. Francis Santos, but unfortunately, I guess he had another scheduled meeting, so he wasn't present at this Tuesday's meeting. Oh, gosh. I'm sorry. My memory is, I'm trying to remember.
So during the last, our last interview with you, you were mentioning that there was going to be this assessment, I think, that was going to be conducted of the properties that you guys were looking at. Is it just going to be of these 4, or are you going to have to narrow it down to 1 and then go in and do that site assessment or land assessment or whatever kind of assessment?
Eventually, we're going to need to narrow it down to 1. We need to concentrate which one it will be, so that a more in-depth analysis and assessment, and so that the consultants can come up with finish up their task orders and be prepared to have the budget proposal, the work plan to present to the governor to make the decision, I suppose. So, it's an ongoing, evolving process, and so yes.
Yeah.
Eventually, we're going to need to narrow it down to one, or the governor will make the decision as far as which location really is going to be the best location for the greater good of the island of Guam.
Right. And so we got that release from Vice Speaker Barnes' office regarding the can't remember what it was called, the 21st century construction
Center of Excellence.
Yeah.
Center of Excellence. Right.
And that was based on discussions that she had with you, as well as Therese Areola.
Arts and Augustine.
Yeah, right. So if you could tell us a little bit more about this bill and what we're actually looking at, because initially I thought it was just going to be a hospital and central public health central facility, but now it sounds like it's going to be something a lot bigger.
Correct. And it's basically the same as what this task force that is focused on. It's not just a hospital; it's a medical center, and it's a campus that will incorporate the three major health facilities, government health facilities. So we're working in tandem. This task force that we have put together, that the governor has put together, is working in tandem with this legislative bill that Senators Joe San Augustine and Tina Barnes. They've crafted this legislation, this bill, and so it's working in tandem with each other.
Do you guys have any idea how much something like this is going to cost? Because the U.S. Army Corps of Engineers report was $743 million, right, just for the hospital. So now so now we're talking about adding on public health and adding on the Guam behavioral health. Yeah.
Right.
Is there any kind of dollar figure you guys are projecting on how much this is going to cost?
Not yet. We haven't gotten to that point, but we will. We're going to need to have an idea. And that's what this performance-based contract consultant is in the work plan that they're going to be, and the proposal budget is going to encompass all that cost.
But you guys don't have like some kind of preliminary figure you're looking at? But it's definitely going to be over the 743 million, right?
Sure. Absolutely. Yeah. We haven't got to that point yet.
Do you have any timelines?
Not yet. We haven't gotten a timeline, but the groundbreaking is October 2022. So we're going to need to have a timeline, definitely. And so the target to break the ground of the selected site, it's going to be October 2022. So we have to really be burning the midnight oil to keep the discussion and come up with finish up the task work that has been delineated and set forth in this OEA grant that was approved.
So you've got this major project that you're working on. You're on this task force. But if I wanted to follow up on something the governor said in her State of the Island address, was that you're going to be also leading up reaccreditation for GMH, and that was also something that we talked about in the last interview. What update can you provide? Because you were mentioning how we might have to go with another accrediting body, right? Other than JCO. Right. So where are we with that?
Already on conference calls, and we've had presentations from 3 accrediting organizations that our compliance administrator has reached out and has scheduled those discussions. The first one that we had a meeting with via Zoom is the accrediting organization called Center for Improvement in Healthcare Quality. Very impressive organization. They have, I believe, accredited 600 hospitals. And so I was really impressed with the presentation. The second one that we met with via Zoom is an organization that started out as a risk management company in the 1800s in Norway. It's called DNV, D as in daughter, N as in national, V as in Victor. It stands for debt Det Norske Veritas, because, you know, it originated again in Norway. We had a meeting with them last week. They are very global, and I can't remember how many hospitals and health facilities that they've accredited, but they are very global. I wasn't too impressed with that discussion. We asked what their fee, you know, ballpark figure in terms of a fee, and they really couldn't give us an estimate. We had to apply first, and then they can then estimate what it will cost the hospital, you know, for them to do an initial on-site survey. Just this week, we had a conference call with the Joint Commission, and it was a very good presentation, very good discussion. So we are getting more data, more information from these three organizations that then we can present to the Board of Trustees, and the Board of Trustees can then, you know, decide which one will be the choice to get the hospital reaccredited or accredited. So yes, we're moving along with that one. Our compliance administrator is doing a really great job. Her and the A team, they're designing the roadmap as far as what all that we need to do to get to that end point of getting the hospital surveyed, and hopefully we meet the accreditation standards, and that we will then be accredited or reaccredited. It's going to take a lot of effort and a lot of education, a lot of training, a lot of engagement from everyone, including the doctors. And so we're putting it out there, you know, putting the word out there. And so the excitement and the enthusiasm is picking up.
Do you guys have a timeline on which one you're going to go with, but make a final decision?
Not yet. We're still exploring. You know, the first conference call that we had with the Center for Improvement in Healthcare Quality, I was quite impressed with that one. But, you know, comparing it to the Joint Commission is really quite established, and they've accredited like about 40,000 hospitals and healthcare organizations. So they've established themselves very credible. And the cost that we had asked, it seems to be pretty reasonable. You know, it was just unfortunate that I think the first time that the hospital went for accreditation with the Joint Commission, you know, the fee that they charged was quite a steep fee. It was somewhere in the $40,000 to $60,000 it cost the hospital, and so that was a concern in terms of the cost. But when we had the meeting this week with the representative from the Joint Commission, it was quite reasonable what he had shared with us in terms of an estimate in costs. So we're still getting more information, and then we'll present it to the Board of Trustees.
Who do we currently go with for accreditation? Is it Joint Commission?
It was the Joint Commission, and that was back in 2016 or earlier, and then we lost it in 2018.
Right. Lillian, can I just ask, because, you know, layman's terms, like, are any of these other accrediting groups, they're all like totally legit on the same level as the JCO? It's not like we're going to the B squad or anything?
They are. They've been deemed by Medicare, you know, to provide the deemed status. And so they're recognized by CMS.
Thank you.
Okay.
What about the run-of-the-mill stuff, visiting patients, all that kind of stuff? Where are we with that, the status at the hospital?
The visitation, yeah. We are allowing family members, one family member, to be with their loved one in the emergency room. So we're allowing that, whereas before we didn't allow, but now we are allowing one family member. We are allowing family member to be with their loved ones who are 75 years and older, or that, you know, they are high risk for fall, or, you know, they get disoriented. And so we want to make sure that a family member stays with that patient to ensure that, you know, the patient is not confused, or that they won't be so anxious. So we're doing that for now. We're still really seriously thinking, and we're discussing it, how we're going to, you know, open up the visitation. And so perhaps, because we still have COVID patients coming through ER and, you know, being admitted. So we're still then exercising caution But we are on a case by case. We also, when families ask us, especially if the loved one is, near death, and so we're compassionate and we're sensitive to those.
Lillian, for those family members that you're allowing up into the facility, are there any eligibilities they have to meet? Like, do they have to be vaccinated, or do they just have to obviously wear the mask and all that stuff?
We're not requiring, we're not mandating vaccination. We're not testing the visitors either. They come with their ID so that, we can also keep track if in the event that there's someone who is COVID positive and we can trace, we can do the tracing. So we're still registering the visitors.
Thank you, Lillian.
You're welcome.
Hey, when's GMH week? Do you guys got like a GMH week?
There's a National Hospital Week coming up the first week of May. I think it's May 6th through the 12th or May 9th through the 12th. Because it's also in alignment with the National Nurses Week.
Wow.
So
We got to do it up, Lillian. We got
Let's
to
do
do
it.
it up.
Fiesta.
Hey,
we can do some.
my